Spinal cord injury is a serious and often life-altering condition that affects the central nervous system. It occurs when there's damage to any part of the spinal cord, which disrupts communication between the brain and the rest of the body. The spinal cord is a long, thin bundle of nerves that extends from the brain to the lower back. It's the main pathway for information connecting the brain and peripheral nervous system. Think of it as a superhighway that carries messages between your brain and the rest of your body, controlling movement, sensation, and autonomic functions like breathing and blood pressure. This spinal cord is protected by the vertebrae, which is the series of bones that make up the spine. Despite this protection, the spinal cord is vulnerable to injury, and when damaged, the consequences can be severe and long-lasting. Spinal cord injuries are relatively uncommon, with an estimated 17,000 new cases occurring each year in the United States alone. Worldwide, the annual incidence ranges from 13 to 33 cases per million people. These injuries can happen to anyone, but they're more common in certain groups. Young adults, particularly males between 16 and 30 years old, are at higher risk due to their involvement in high-risk activities. It's also common among older adults, often due to falls. Types of spinal cord injury. There are two main types of spinal cord injury: complete and incomplete. These terms refer to the extent of damage to the spinal cord and how much function remains below the level of injury. Number 1. Complete spinal cord injury. A complete spinal cord injury results in a total loss of function below the level of the injury. This means that the person loses all sensation and voluntary movement in the areas of the body controlled by nerves below the point of damage. In these cases, the spinal cord is either fully severed or so severely compressed that the brain can no longer communicate with the body below the injury site. Complete injuries often result in paralysis, which can be either paraplegia, affecting the lower body, or quadriplegia, affecting both the upper and lower body, including the arms, legs, and sometimes respiratory function. Number 2. Incomplete spinal cord injury. An incomplete spinal cord injury occurs when the spinal cord is only partially damaged, meaning some communication between the brain and the body remains intact. In these cases, the person may retain some movement, sensation, or function below the level of the injury. The degree of recovery varies widely among individuals with incomplete injuries, as it depends on which parts of the spinal cord were damaged and how much function is preserved. People with incomplete injuries generally have better chances of regaining some movement and feeling as they undergo treatment and rehabilitation. Causes of spinal cord injury. The causes of spinal cord injuries can be broadly categorized into two groups: traumatic and non-traumatic. Traumatic spinal cord injuries are the result of a sudden and forceful impact that damages the spinal cord. Motor vehicle accidents are the leading cause of traumatic spinal cord injuries, accounting for nearly half of all cases. In these accidents, the force of a collision or sudden stop can cause the vertebrae to fracture or dislocate, putting pressure on or cutting the spinal cord. Falls are another leading cause, especially among older adults. This can include falls from heights, like ladders or roofs, but even a seemingly minor fall for an elderly person can result in spinal cord injury due to pre-existing conditions like osteoporosis that weaken the bones. Sports, particularly high-impact or extreme sports, are also significant contributors to spinal cord injuries. Diving accidents, where someone dives into water that's too shallow, are a notable cause of cervical spine injuries. Other than that, violence, including gunshot wounds and knife attacks, is unfortunately another cause of spinal cord injuries. The penetrating trauma from these incidents can directly damage the spinal cord. Non-traumatic spinal cord injuries, on the other hand, occur due to medical conditions or degenerative diseases that affect the spinal cord over time. Some common non-traumatic causes include tumors, infections, inflammation, and conditions like multiple sclerosis. In these cases, the spinal cord may become compressed or damaged due to factors like swelling, a growing mass, or the breakdown of nerve tissue. While non-traumatic spinal cord injuries can develop gradually, they can still result in significant and lasting impairments. Symptoms of spinal cord injury. The symptoms of a spinal cord injury can vary dramatically depending on the severity and location of the injury. However, there are some common signs that often appear immediately after the injury occurs. One of the most noticeable symptoms is loss of movement, or paralysis, below the level of the injury. Paralysis occurs when the brain can no longer send signals to the muscles to initiate movement. If the injury is high on the spinal cord, such as in the cervical region, then paralysis can affect both the arms and legs as well as the trunk. In lower spinal cord injuries, such as those affecting the thoracic or lumbar region, paralysis may be confined to the legs. Along with loss of movement, there's often a loss of sensation. People might not be able to feel touch, heat, or cold below the injury site. Many individuals with spinal cord injuries describe experiencing intense pain or a stinging sensation, similar to a strong electric shock. This is caused by damage to the nerve fibers in the spinal cord. Some people also report a feeling of pressure in the head, neck, or back. Spinal cord injuries can also disrupt autonomic functions, which are those bodily functions that occur automatically without conscious thought. These include things like breathing, heart rate, and digestion. In severe cases, a spinal cord injury can affect breathing if the injury is high enough to paralyze the muscles needed for respiration. The bladder and bowel can also be affected, leading to issues with incontinence or constipation. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of spinal cord injury. Diagnosing a spinal cord injury typically begins at the scene of the accident or injury. Emergency responders are trained to suspect a spinal cord injury in any person who has experienced significant trauma, especially to the head or neck. They will immobilize the spine to prevent further damage during transport to the hospital. Once at the hospital, doctors will perform a thorough neurological examination. So, the doctor will typically ask the patient to try to move various parts of their body and will check for sensation in different areas. Imaging tests play a crucial role in diagnosing spinal cord injuries. X-rays are often the first step, as they can show fractures or misalignments in the vertebrae that might be compressing the spinal cord. However, X-rays alone cannot provide a complete picture of the injury, so additional imaging tests like CT scans or MRIs are typically needed. Treatment for spinal cord injury. Treatment for spinal cord injuries is complex and often requires a multi-step approach. The immediate goal after injury is to prevent further damage. This often involves immobilizing the spine and controlling inflammation. Surgery is often necessary, especially if there's ongoing compression of the spinal cord or if the spine needs stabilization. Surgeons might remove fragments of bone, foreign objects, herniated discs, or fractured vertebrae that are compressing the spinal cord. In some cases, metal rods or screws are used to hold the vertebrae in place and reduce the risk of further damage. Medications may also be used to reduce swelling and inflammation in the spinal cord. Steroids like methylprednisolone have been used in the past to minimize inflammation and limit the extent of damage, though their use has become more controversial in recent years due to potential side effects. However, doctors may administer other medications to manage pain, prevent infections, and support breathing if necessary. Rehabilitation is a critical component of spinal cord injury treatment, and it begins as soon as possible after the injury. Physical therapy helps individuals regain as much movement and strength as possible, focusing on improving mobility, flexibility, and coordination. For those with incomplete spinal cord injuries, rehabilitation can lead to significant improvements in function. While some nerve pathways remain damaged, the brain can sometimes form new connections to bypass the injured areas, allowing for partial recovery of movement or sensation. This process is known as neuroplasticity, and it offers hope for many people with spinal cord injuries. In some cases, assistive devices such as wheelchairs, braces, or exoskeletons may be used to enhance mobility and independence. Occupational therapy also focuses on helping individuals adapt to their new physical limitations, teaching them how to perform daily tasks such as dressing, grooming, and eating. These therapies aim to maximize a person's independence and quality of life, even if full recovery is not possible. Now, we want to hear from you. Have you or someone you know ever dealt with a spinal cord injury? What were the biggest challenges during recovery, and how did you overcome them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.